Welcome, everybody. This is to the Observatory Weekly Webinar Series on building resilient and high-performing health systems. My name is Ewout van Ginneken of the European Observatory, and I will be moderating today together with my colleague Erica Richardson, who I will introduce later. Today, we will talk about mental health. The COVID-19 pandemic has brought increased awareness regarding mental health, particularly also among policymakers, which is potentially a great thing. And countries we have seen have faced many challenges trying to meet the increased demand of mental health services, and sometimes already really struggling with the increased mental health burden before the crisis started. More positively, the pandemic has also been a catalyst for systemic changes, including what we've seen, a shift to remote consultations, increased investments, and also some more attention to the mental health of the health workers themselves. So in this webinar, we would like to discuss questions like, how have different countries responded? What were the common challenges? How can we use the momentum greater awareness has brought to us? But also, how can we evaluate the impact of recent innovations in health systems? We'd like to do this with the following speakers. We will first start with Janet Cummings, who will provide an overview of mental health reforms during COVID. And Janet is an associate professor in the Department of Health Policy and Management at Emory University, Rollins School of Public Health in the United States. And Janet is a health service researcher, and she studies access to and quality of mental health services among underserved populations. But she's also a deputy director of a center that disseminates evidence-based mental health programs and practices in the southern United States. Then we will move to France, to Coralie Gandre. And Coralie is a research fellow at the Institute for Research and Information in Health Economics, IRDES, in Paris. She's a pharmacist with a PhD in public health, and her research interests cover health services research and mental health. And then we will move to Portugal to hear from Gonçalo Figueiredo Augusto, who is an assistant professor at the National School of Public Health in the Nova University, Lisbon. And he is a public health medical doctor researching health systems and policies. Then we will have a more international perspective from Jonathan Campion. Jonathan is a director for public mental health and consultant psychiatrist at South London and Maudsley NHS Foundation Trust. He is also a chair of the Public Mental Health Working Group for the World Psychiatric Association. And last but not least, he's an advisor to the WHO Europe on public mental health and COVID-19. So that seems to be the right person to talk to today. Welcome to all of you, and we are very grateful to have you here. But before we go to Janet, we will first go to Erica, who will introduce a poll about mental health in your countries.
Hello, everyone, and welcome. Thank you very much for joining us today. So just a quick poll to see where we are. Annalisa, if you could launch the poll. Okay, so just two questions. Firstly, in your country, has COVID-19 been a catalyst for mental health system reform? And that's just a straightforward yes or no. But then also to go into a bit more detail, what have been the top challenges in the mental health system during COVID-19? So has this been to do with insufficient funding, workforce shortages, workforce burnout, transition to telehealth, or none of the above? So it'd be really interesting to find out your thoughts on this. Thank you very much. Okay, Eva, back to you.
Thank you, Erica. We will hear the results later, but in the meantime, we will go to Janet. So Janet, if you switch on your camera, and the floor is yours.
I'm very glad to have a chance to speak with you all today about a collaborative project I've been working on with the HSPM network. And before I talk about our study, I'd like to provide a bit of background information. And I think it's always good to start off with some definitions just to get everyone on the same page. So using definitions provided by the World Health Organization, I think it's helpful to first define what we mean by mental health before moving on to mental disorders. So the World Health Organization defines mental health as a state of well-being, enabling individuals to realize their abilities, cope with the normal stresses of life, work productively and fruitfully, and make a contribution to their communities. And then mental disorders refer to a combination of abnormal thoughts, perceptions, emotions, behavior, and relationships with others. And then I think it's also important to recognize that many mental disorders also have a somatic component as well. And you see here, I've listed some examples of both specific types of mental disorders as well as classes. And I have mood and anxiety disorders listed at the top because they are among the most prevalent. So we also know that mental disorders are common and they have a number of short and long-term adverse consequences. So here are some numbers on the prevalence of depression and anxiety. This is from 2019, before the pandemic, and this is for adults ages 20 and older. And you can see here that the prevalence of depression was around somewhere between 5.5% to 5.8%. And the prevalence of anxiety ranged from 5.2% to about 7.5%. And this was across Western Europe, the United Kingdom, and the United States. And then when we're thinking about the consequences, again, I think depression provides a good example because it's among the leading causes of disability worldwide, a major contributor to the global burden of disease. And then suicide, also incredibly important to consider. It's the fourth leading cause of death among those ages 15 to 29. So the good news is that there are effective treatments available for mental disorders. There are a number of psychotropic medications, including antipsychotics, antidepressants, mood stabilizers that can be prescribed to treat different types of mental disorders. And then we also have evidence-based psychotherapy and psychosocial services interventions, and these can include many different types of talk therapies, such as cognitive behavioral therapy. But the unfortunate news is that there is an enormous treatment gap. There's just this massive gap between the services and treatments that are potentially available and the number of those who actually received evidence-based care. So I offer one example here on this slide from a study in the early 2000s. This was conducted in 6 Western European countries. And this study found that 26% of those with an anxiety disorder in the past year and 36% of those with a mood disorder in the past year had received any formal health services. And so on the flip side, you can see how large the chasm is and the enormous proportion that were not receiving any formal health services. And we also have emerging evidence coming from countries around the globe that the pandemic is adversely affecting mental health. I have some findings from 3 different studies here. I'd like to focus on the findings from Belgium in the middle, where we've learned that the prevalence of anxiety and depression more than doubled between 2018 and April 2020. So with this context, I'd now like to tell you a little bit about our recent study. And this is a project, again, conducted in collaboration with the HSPM network. Our objectives here were to collect data from experts in multiple countries to first understand what are the common challenges in mental health systems during the pandemic. And then second, to identify types of policies and initiatives that were implemented to address these challenges. So we shared a structured questionnaire with experts in 14 countries, and this was conducted between January and June 2021. And this questionnaire included both closed-ended and open-ended items. And then we have the 14 countries listed here. We have incredible experts from each of these countries, also a co-author on this work. And I just want to offer my tremendous thanks to each of them for contributing their knowledge on their mental health system. And I want to recognize that the majority, although not all of these individuals, are part of the HSPM network. So the countries were selected to reflect diverse health systems in terms of size, geography, the type of health system, the level of decentralization. And we have one metric here just to give a sense of this variation, the size of the mental health workforce. So we have psychiatrists per capita in blue, psychologists per capita in orange, and other mental health providers per capita in gray. And you can just see here from the 14 countries that we do have a lot of variation in the workforce size. Now, we use two open-ended questions to ask participants to describe up to 3 major challenges for the mental health system and up to 3 major challenges for the mental health workforce during COVID. And I'm going to start with the top challenges for mental health systems during the pandemic. So one challenge that was described was a sizable reduction in service provision within facilities. This was earlier in the pandemic, and the financial impact of these reductions. So this included an impact on hospitals and outpatient settings, and there were implications for both quality and the workforce. A second challenge that came up in the short term was a decline in the demand for services among those with mental health needs. And there were particular concerns about what this could mean for quality of care for those with more serious mental illnesses such as schizophrenia and psychoses. The most common challenge and concern that was reported is both the current and the anticipated increase in the demand for mental health services because of the stressors associated with the pandemic, the economic downturn, and other social determinants of health. And then a fourth challenge had to do with the implementation of telehealth. And there were 2 issues that came up here. One, again, concerns about quality of care for those with more severe mental illnesses. But a second concern in some of the countries had to do with limited access to technology or limited connectivity to the internet in some of the communities. So we then asked respondents to provide information about up to 3 challenges faced by the workforce. So one major challenge was the impact of the pandemic on the mental health of the workforce. And in some places, this was exacerbated by the mental health provider shortages. Another challenge that came up was the impact on the physical health of the workforce, including both the risk of infection and absenteeism. And then finally, some experts talked about the loss of face-to-face contact with the transition to telehealth and some of the challenges this posed for providers. So next, I'm going to present findings on national mental health policies and initiatives during the pandemic. And first, we have results from a series of closed-ended questions that were asked of all respondents about telemental health policies and initiatives. And in every country, experts reported that psychiatrists and therapists were delivering more telehealth during the pandemic than before, which is not a surprise. But then we also learned that in 11 of the 14 countries, the governments had relaxed regulations to facilitate mental health, and in 7 of the countries, these changes were indefinite. We also learned that in 9 of the countries, reimbursement policies had been changed to also facilitate telemental health. And in 4 of the countries, these changes were indefinite. And then finally, I'm going to present some findings from other mental health policies and initiatives during the pandemic. Now, these findings come from an open-ended question where we were asking experts to list up to 3 national mental health policies or initiatives. Now, the results here aren't meant to make comparisons across countries. We were just looking for commonalities in the policies and initiatives that did occur. And on the right, you'll see I have a pyramid that represents the optimal mix of mental health services identified by the World Health Organization. So as you move from the bottom to the top of the pyramid, what you do is you're moving from services that can be provided to the broad population, where most of mental health can be self-managed, but then up to the top of the pyramid where you need a more formalized network of services, including primary care and specialized mental health services in outpatient and hospital settings. Now I'm going to summarize the findings starting at the bottom and moving to the top. Although it's not explicitly addressed in the pyramid, I thought it was worth highlighting finding from 2 countries, Italy and the Netherlands. Both created new national guidance and frameworks for mental health during the pandemic. Several countries reported initiatives to improve mental health literacy, and this can map onto the foundation of the pyramid, which is improving self-care at the population level. So in Hungary, for example, the National Public Health Center created a web page and informational leaflets for health professionals and the general public in 2020, addressing topics such as adaptation to lockdown and stress management. Moving up to the next finding, another type of initiative at the population level reported by experts in several countries was the provision of low cost or free mental health services accessible to the entire population, such as the provision of telephone lines for those with any mental health concerns. And then the next finding pertains to policies and initiatives at higher levels of mental health need, where experts reported at least one policy or initiative where there were additional resources for specialty mental health services, such as increased funding for mental health providers or facilities. In Latvia, the pandemic led to an advancement of longstanding issues about healthcare financing and resulted in increases in salaries for mental health providers starting in 2021. And then finally, a number of countries reported new initiatives or policies to further bolster suicide prevention and crisis services. Now, when we ask countries to report on policies and initiatives to address mental health workforce challenges, we learned that a number of countries had implemented initiatives to address burnout, which is a good thing since that was one of the top challenges reported for the mental health workforce. And then a number of countries also reported initiatives to increase training on telemental health for psychiatrists and therapists. And so just to briefly recap some of the emerging findings. The shift to telehealth was universal, and in 11 of the countries, we saw changes in policies and regulations to facilitate telemental health. And another key finding is that the most commonly reported challenge for mental health systems is the pending increase in demand for services. But on a positive note, we saw a number of new policies and initiatives at all levels of the World Health Organization pyramid of the optimal mix of services. And then some interesting questions moving forward will be whether the new programs and initiatives can be sustained and what are the barriers and facilitators to sustainment. So, thank you very much.
Thank you very much, Janet. Now I'm actually really curious also to see what the results of our poll are and whether the people who are viewing today see the same developments in their countries. So, Erica, could you show us the results?
Absolutely. Annalisa, if you could share the results. So, interestingly, in about half of the respondents in the audience, COVID-19 hasn't been a catalyst for mental health system reform. And that's quite interesting, particularly as I've noted from very familiar names in the among the attendees. We've got a very broad cross-section of the European region. So when it comes to the top challenges that the mental health system is currently facing, workforce shortages are by far the biggest challenge that's faced, but also insufficient funding and workforce burnout. So interestingly, 6 respondents said that none of the above. So it'd be interesting to hear in the chat box what the challenges that have been faced in those countries have been. So thank you very much for that, everybody. Really interesting.
Thank you very much, Erica. Yeah, it's interesting that the workforce questions were the main challenge seen here, because that's actually how our collaboration started. Before COVID, that's what we wanted to research. Then COVID happened and we moved it around a little bit. But now let's go to France. Let's go to Coralie.
So good morning, everyone. I'm going to talk about France because France is the example of a country where the COVID-19 pandemic has actually led to new reform for mental health on the longer term. So I thought this could be interesting for other countries as well. So first of all, I wanted to say that the French mental health system was already experiencing quite a lot of issues before the pandemic that were only highlighted and aggravated by the crisis, but that were already there. And in particular, we have a saturated public system, which is mostly managed by hospital, even for outpatient care. And this is particularly visible for access to ambulatory care center. In some French territories, there are waiting times which can go up to several months. And unfortunately, it's not compensated by easy access to community mental care. GP are insufficiently trained to detect and treat mental disorder in their patient population. There are also geographic disparities in access to care, which are particularly striking for psychiatrists. So I don't know if you remember the slide of Janet on workforce, but you may have noticed that we have quite a lot of psychiatrists in France, but they are actually clustered in urban centers, which makes their access quite difficult. And there are also financial barriers, in particular for access to private psychologist visits, because they are not included in the social health insurance benefit package. So all in all, in France, before the crisis, there were no standardized care pathway based on the severity of disorder, what we called a step care approach. And so it was quite difficult for patients to know where they should turn to when they were experiencing mental health issues. But fortunately, the pandemic has led to increased political focus on mental health. What you should know first is that the current French government had only issued a rather unambitious roadmap for mental health in 2018 and was not especially planning to do more for mental health. But due to the attention that was shed on this dimension of health, at the end of 2020, they started communicating data on the mental health of the French population in news conference on the pandemic. So that was the first time it happened in France. And then in 2021, the government announced temporary coverage of private psychologists' visits by the social health insurance funds for specific population, which were youth and students. And there were also initiatives by voluntary health insurance to increase coverage for this type of care, but this was only temporary. Finally, in June 2021, the government launched a national online consultation with all stakeholders on the future of mental health. And this led to 2 days of public debates at the end of September, which were concluded by the announcement of new long-term measures for the mental health system in France. And now I want to focus on one of the measures which was announced by the French president to show that COVID-19 can actually be a catalyst for long-term change and welcome change in the mental health system. So the measure I want to focus on is the inclusion of private psychologist visits in the social health insurance benefit basket. It will start as soon as 2022. It will be upon medical prescription only with fixed tariff, no extra billing possible, and a limited number of visits, which have been announced at 8 for now. And it's actually a very positive consequence of the pandemic, because before the pandemic, it was already a reform which was under consideration in France, but there was no plan to roll it out nationally in the short term. And this is a reform which has many potential benefits. If you remember some of the limits of the French mental health systems that I discussed at the beginning, it could increase access to psychotherapy and in turn reduce inappropriate antidepressant prescription, which are particularly high in France. And then refocus specialized medical care on the most complex cases, therefore reducing waiting time and organizing a gradual provision of mental care. But what I wanted to bring to the discussion to finish is that maybe COVID-19 could have led to a bit too rushed reform for the mental health system, because this national rollout was actually decided without awaiting the result of pilot testing ongoing since 2018 in several local French territory, and which could have ensured better adherence of the involved professional. When this reform was announced, psychologists went to the street, as is common in France, to say that they didn't agree with the tariffs, they didn't agree with the medical prescription. Psychiatrists also don't really know what is the role in the reform, and coordination tools are not in place, and in particular GP still are not trained to know which patients they should address to psychologists. And finally, some reform which would have been necessary prior to this one, such as the recognition of psychologists as health professionals in legal text, or the standardization of their training, which is currently not the case in France, will actually be implemented concurrently to this new social health insurance coverage, while they should have been implemented prior. So all in all, COVID-19 has triggered more attention for mental health, very interesting reform that could represent a potential loss of opportunity for an efficient reform from the start. That's all for the French example.
Thank you much. Thank you very much, Coralie. Great cautionary notes that although there is an opportunity, we should not perhaps rush into reforms, and the need for evidence also to support these reforms. Now I'm really curious to hear from Gonçalo and what's happening in Portugal and has happened in Portugal, and whether he sees perhaps similar developments. Gonçalo, please.
Hello, everyone. Well, Portugal also has some interesting example on mental health reform. Actually, the mental health reform was launched in 2007, so it's quite an old reform, and it was a very ambitious one when it was launched by then. Meanwhile, the reform started and it achieved some of its goals, but meanwhile there was the political and mostly the social and economical crisis on 2011 to 2014 with a bailout, and the mental health reform was somehow not prioritized. It was not on top of the political priorities, and it was only restarted after 2015 and especially after 2018. When there were elections in 2019, it was a clear political priority in the government program to conclude the mental health reform. 2019, just before the pandemic. Those are some of the core objectives of the mental health reform in Portugal. So it was to complete the mental health service network, and especially to shift the hospital care to community mental health care, changing the management model, and to quite strengthen the links with primary care and the long-term care network, disabling psychiatric hospitals, which was the steps that were taken before the crisis, so between 2007 and 2011. In 10 years, there were very heterogeneous results. The difficulties of implementation were clear in several areas, mainly the part of the community mental health services, and there were barriers that were the same over and over again. So we can conclude the solution was mainly political, and that's why the fact that in the 2019 elections the conclusion of the mental health reform was clearly stated in the government program was good news. Then there was the pandemic, and everything changed. We know that the pandemic increased some mental health problems, mainly due to the lockdown and the distance. Anxiety, symptoms of anxiety and depression increased, and the mental health program applied the WHO model, this 4-level pyramid that Janet showed, and launched a number of initiatives, namely on the self-care level, with the promotion of mental health literacy, important role of the media on the news, interviews, etc., websites. On the community level, there were some outlines that were launched, specific outlines to psychological support and also to healthcare workers. On primary care, there were the activation of local response emergency teams. Those teams that exist in case of catastrophes, they were activated, and in order to provide effective services on the primary care level. And on hospital care, the mental health services were urged to keep in touch with patients through telehealth. And actually, they were very successful in doing so. The psychiatric outpatient consultations were the only ones that increased during the first half of 2020, in contrast with all other specialties that, as we know, decreased a lot. Some of the challenges that remain, in fact, the mental health services were quite overstretched before 2020, and there was the financial gap. There was the lack of political priority that was about to be solved. Also, there is the very important subject of healthcare workers burnout, and also the kind of shift that was forced by the pandemic. We were driving care to community level, while the pandemic did the opposite way. The two big challenges that remain are those: how to ensure the objectives of mental health in a prolonged pandemic. We don't know how long we'll be dealing with COVID-19, and also how to resume what's left of the mental health reform. And what's left are very important steps in terms of community mental health teams. How to resume this mental health reform after the pandemic.
Thank you very much, Gonzalo. From this perspective from Portugal, also here, I think you see similarly that the next steps are going to be important, right? And I think there's a clear parallel with France there. Let's go now to Jonathan. Jonathan, who can give us an international perspective and also what WHO is doing in the field. So I'm really curious to hear from you also what you have to say about our non-scientific poll that half of the people see no changes, which could mean that there are no changes, but there should be. I'm curious to hear with your global perspective what you have seen and heard. Jonathan.
Thanks very much, and delighted to be part of this webinar. I just wanted to start by highlighting that globally, just in terms of context, at least 20% of disease burden is due to mental health conditions, and that's associated with an anticipated economic annual cost of at least $6 trillion by 2030. So it's a huge issue, and the reasons: high prevalence of mental health conditions, majority of those arising before adulthood and then extending across adulthood, and then broad impacts both within health and actually more broadly across different sectors. And similarly, the impacts of mental well-being also extend across health and other sectors. COVID impacted on mental health, associated with increased rates of mental health conditions in the general population following COVID outbreaks and the introduction of containment measures, which cohort studies indicated then reduced during reopening. Particular groups particularly affected, such as children, young people. Impact of quarantine, relatively small but greater in particular groups. Increased alcohol consumption, no evidence of increased suicide, but COVID infection increased the risk of mental health conditions, and also people with mental health conditions were at increased risk of infection and associated death. And then finally, COVID-19 also had very large impacts across risk factors for mental health conditions. So the good news that there are effective interventions both to treat mental health conditions, prevent associated impacts, prevent them from arising in the first place, and promote mental well-being and resilience. It's important to say treatment alone has limited impacts on averting that disease burden I first mentioned, but obviously is very important. And many interventions also result in economic savings even in the short term. However, there's a big implementation gap. Even before COVID, only a minority of people with a mental health condition received any treatment, and the far less coverage of interventions to prevent associated impacts, negligible coverage of interventions to prevent those conditions from arising in the first place or promote mental well-being resilience. And that gap resulted in scale population suffering, broad impacts and associated costs, and also breaches the right to health. Various causes of the implementation gap are important to assess. So lack of resource and staff. So it's only 2% of global government health expenditure is allocated to mental health. There's a lack of information about the size of the gap, lack of mental health policy in 25% of countries globally, but otherwise there's a lack of scale implementation even where policy exists, and there's a lack of use of evidence in population health policies and a lack of public mental health knowledge. Unfortunately, this implementation gap further widened during COVID, indicating that essentially systems were unprepared for the pandemic, and mental, neurological and substance use disorders programs were the most disrupted out of any program. So the WHO Mental Health Atlas last year confirmed these massive inequalities in availability of mental health resources and their allocation, significant gaps globally between existence of policies, plans and laws and the implementation. So essentially various opportunities exist to address the gap, and COVID is an opportunity highlighted by the interest, both by population and government, as outlined by Coralie in her presentation. The UN SDG of universal coverage by 2030 includes treatment and prevention of mental health conditions and promotion of mental health, and that's an important driver. The World Psychiatric Association represents 250,000 psychiatrists in 121 countries and has made public mental health a key part of its 2020-2023 action plan. And the WHO European Framework for Action on Mental Health, which extends to 2025, is the basis for intensified efforts across the region to promote mental well-being and provide better services for both treatment, prevention, and promotion. And essentially, it reiterates the political commitment. It urges states to reiterate their political commitment to and leadership in placing mental health at the heart of efforts to achieve this universal health coverage. It urges adequate funding, efficient uses of resources, promotes government structures, policy frameworks and regulations in support of mental health that build partnerships. It also urges the promotion of mental health and also action to address determinants, and highlights the importance of prioritizing particular higher risk groups such as children and adolescents, also to support research on how we scale up. And the implementation of this framework is essentially supported through a pan-European mental health coalition flagship, which has just been launched by the Queen of Belgium at the end of September. There are various other mechanisms to address the gap, such as looking at what is the level of unmet need in a country, and then looking at what is an appropriate level of implementation, an acceptable level of implementation, and then using that method to then assess outcomes, including coverage. Also thinking about settings-based approaches, integrated approaches, use of digital technology, not only just for treatment, but also for prevention and promotion, the maximizing of existing resources, appropriate training, a focus on particular interventions and higher risk groups, and the use of human rights approach and legislation. Thank you.
Thank you very much, Jonathan. That was a very good overview of all the initiatives happening, and also more of a global perspective. I would now want to ask all the panelists to switch on their cameras, and then we'll go to Erica to see if there was activity in the chat box.
Hello there. People are being a little shy in the chat box, and I recommend you get your questions in early so that we can actually put them forward. So couple of follow-up questions for specifically for certain speakers. So for Gonzalo, it was Lyubov wanted to know, wanted you to clarify whether it was part of a national response, was it a pilot program or was it the full implementation? And there's a little follow-on question from Gaetan asking Janet, if you can elaborate a bit more on what you call the pending increase in demand for mental health care. So what are the factors that are going to expected to increase the demand in the years ahead, and so on. There are also a couple of extra questions from me, because I'm really interested in telehealth, and I'm really interested to know what we feel the future for telehealth is in the provision of mental health services, sort of moving on in the sort of post-pandemic years. And will telehealth be one of the tools that will help narrow the treatment gap that was in place before the start of the pandemic? So I've got some other questions here, but let's start with those. Thank you very much.
So let's then just start with the question that we got from Luba. Hi, Luba. For Gonzalo. Gonzalo, would you answer her question?
So the reform was quite comprehensive. Some of the measures that were part of the reform were not piloted. Some of the measures were to close psychiatric hospitals, to close psychiatric, to refurbish mental health awards in hospitals. So some of those measures were actually a question of implementation. Others, such as the community mental health teams, were in fact piloted. So right now, the first step of the mental health teams at community level was to launch. They are already in place. One mental health for adults and one mental health team for pediatric, for children and adolescents per region. So 5 mental health teams in place for adults, one in each health region in Portugal, and 5 mental health teams for children and adolescents in each mental health in each health region. The future is to, of course, to expand those community mental health teams at all over the region. So especially here in Lisbon, there is a huge demand, and in the north, in Porto, there is a huge demand for mental health, and so to replicate these experiences in smaller teams closer to the people.
Okay, thank you, Gonzalo. Janet, there was a question from Gaetan about the pending increase in demand. It's a good question, actually. Would you like to address it?
Yes, no, thank you. That's a great question. And the question is asking whether the impacts may be temporary because of lockdowns. And that's a piece of it. But I think there are a number of other issues where the experts participating in our project recognize that they could have an impact on mental health in the longer term as well. One piece of this is the effect of the pandemic on the economy and how that and that's going to be cyclical, and it may affect different countries at different times. But when you have an economic downturn and you have incredible job losses, we know that there is a link between poverty and these stressors and adverse mental health outcomes. Another issue is that there's evidence emerging that those with COVID or long COVID, they could be at risk for mental health challenges down the line. So that's another thing to consider. And then also in countries where we've, just seen mortality. I think about the children who have lost parents and caregivers, or the family members, and the trauma of that loss and the impacts that may have beyond the short term as well. So there are a number of factors here where I believe, the experts recognize that we just really need to be attentive to the mental health needs now and also going forward.
Is that also, Jonathan, perhaps we move to you and then we'll do the telehealth question later. Also, you had a specific question here, Jonathan, that I would like you to address. But what do you also have to add to this? What is the pending increase in demand for mental health care? Do you have anything to add here from what you've seen and what you are expecting? And related to that, what is the research that we need to do?
Yeah, thanks. I think what's been interesting is a lot of the research. There's been just mountains of it, and which is fantastic. But a lot of them are surveys. And I think when you look at the cohort studies, and particularly systematic reviews of cohort studies, they indicate that actually the level of mental ill health reduces, as I said, following opening up of reduction of lockdown. So there's something about that particular groups don't seem to have experienced that reduction. So, for instance, children and adolescents in the UK, they've maintained a 50% increased prevalence rate. So there's something about obviously improving coverage, ideally at the earliest opportunity. I think digital has a big opportunity there. And certainly in my trust, that's what we've been doing. But I think really importantly is also to think about how can we prevent the anticipated increased risk of mental health conditions in these particular groups. And I think this is where, for instance, child adversity accounts for a third of adult mental disorder. And we're looking at, for instance, the impacts of COVID on child adversity. What could we be doing more proactively to actually prevent what we would otherwise see happening? And I think similarly, if we're talking about vaccination, I think vaccination to prevent parental death, vaccination to prevent the impacts of COVID infection on causing mental disorder. So I think there's an interesting and a recent interesting US study highlighted the mental health benefits of vaccination, which I think was also interesting. People feel, I guess, reassured, feel slightly safer. So I think there's something about, perhaps those three things too, just as a couple of thoughts.
Thank you. So perhaps Coralie, could you address the question that Erica had about the telehealth? Would you like to repeat it, Erica?
I think it's fine. I remember.
Yeah, it's just about narrowing the gap, the treatment gap in the future.
Yeah, I think telehealth is definitely something that could help reduce unmet needs for care, especially in the field of mental health, because in comparison to other medical specialties, there are a lot of stigma associated with seeking care for mental health issue, and maybe being behind a screen or being behind a phone can help patients actually dare to seek care. But I also think there are some inequities issue with this type of care, especially for people who do not have access to online consultation, to the most deprived population, which are often those with the most mental health need, which are not addressed as well. So I think we have to be careful about it. And just to give the example of France, telehealth consultation for psychiatric care had been fully reimbursed by the social health insurance during the whole pandemic period. So it has increased access to care even when services were closed. But we don't know for sure if this will be prolongated or if it will be only a temporary measure. But I do think that it brings opportunities, telehealth.
Yeah. I see Jonathan nodding yes. Erica, do we have anything else in the chat box?
Yes, got a couple of questions coming on. One sort of following on from sort of that previous discussion. So when we're looking at sort of legacy effects of COVID-19 on mental health, one of the areas that hasn't really come up is the issue of long COVID. And I don't know if that's just because I live in a country with a very high sort of infection rate. It's something that's of particular concern to people in the UK. But long COVID is, how is that going to fit and factor into the challenges to the mental health systems? But also, we're talking about taking a public health approach to sort of reduce the burden of disease before it starts sort of refocus upstream. But it would be really interesting to hear what the policy options are, given this is such a complex area. Is there any research on that? What do we know about that? And again, looking at the policy side of things, do we know what works for burnout, particularly in countries where the health systems are still under huge pressure and health workers are still overworked, and there are, ongoing workforce shortages. So in that sort of very challenging situation, what are our options for reducing burnout or addressing burnout?
Can we perhaps start? Can we perhaps start with the burnout question? I don't know, Janet, maybe you would like to take it. It seems to me that this is going to be not just a problem, for the next year, but it's going to be a long-term problem. What do you know? Are the studies done? How could you address it? Do you have any thoughts, Janet?
I can say that here in the US, we have a number of nationally funded technical assistance centers that have been working very hard to provide, virtual trainings and on this exact topic for our mental health providers. And it's absolutely been a focus. And, the results that we saw from the experts who participated also had similar initiatives. What I think we are going to need to see is just some good studies and evidence to figure out which of these work and are effective to address the burnout. I do think it's going to be a huge issue, and just research on this exact topic is absolutely needed.
I think we have some snapshots on our website on this issue, but mostly what countries have been doing, but not really what the evidence is yet. So I think this is an important area. I know stuff like childcare services, transport for health workers, I don't know, food delivery, just everything to relieve them from daily burden. But as far as I know, I'm not aware of that. This is really researched a lot yet, so that would probably also be one of those things that are important. I don't know if anybody wants to add on that point, because then I would perhaps like to go to long COVID and hear your thoughts on that, how this is going to impact mental health and what kind of approach would that need. I don't know, Gonzalo, would you like to start?
That's a very interesting question because it's just starting to be an issue. So not only on mental health, but the consequences, the respiratory consequences, and the respiratory rehabilitation that some patients will need will probably, or there is that risk to provoke a high demand for hospital services. Not exactly on mental health, but on other specialties. But also the consequences, the mental health consequences of the pandemic are still to be fully understood. It is something has changed and something that we cannot still fully characterize. How people have been severely affected by the pandemic, and I guess that will be an enormous challenge for the upcoming years, and will most probably represent as well a very important issue that mental health services have to address.
I really also appreciated Jonathan's call to do this more upstream and really address early on, to integrate it better in prevention, to have a more integrated approach to mental health. Maybe we can do a very quick round, or maybe Jonathan, you would like to take this one before we wrap up. What are the options? What can we do? Could you elaborate a little bit more here? How can we change the system so that they take mental health not just now as something that you treat, but really also something you want to prevent?
Yeah, thanks. I think given the majority of lifetime child mental health conditions arise during childhood and adolescence, this highlights actually the most important part of the population to both treat early, but also to prevent these conditions from arising, and also promote mental well-being resilience. And so I think, settings-based approaches such as preschool, school-based interventions are particularly important, both to detect, treat early with often social interventions to parents, but also to prevent, promote. And there's been some fantastic meta-analysis level, systematic review level evaluation of interventions which work. Similarly, integrated approaches both within systems and between systems. And this is where I think mapping out of what's actually there at the moment, and then where are the opportunities for these kind of synergies, for these join-ups between different sectors who can work in a more coordinated way to facilitate greater coverage. And I think the digital technology coming in there is a really important opportunity, given the huge implementation gap. Even within low middle income countries, for instance, the use of mobile phones has, again, a systematic review highlighting the very helpful evidence around that. But I think just linking to a final question, one of the questions coming back earlier about which is the most important area of research, I think it's about implementation research. We've got this amazing amount, these huge volumes of fantastic work done by researchers to show us what works for who, but it's not implemented to scale. And so this is where I think a population approach, working with our public health colleagues to really facilitate this, is the real opportunity, and even more so now during COVID.
It really reflects also what we're seeing in integrated care, which mental health is, of course, a part of, that everybody's asking us, how do we implement it? So you're very right for the, to raise the attention to this particular point. I think we should do more on this. I saw two more questions. One question also very interesting, I think, on cross-border health options within Europe. I'm not sure if the panelists are aware of any of this in Europe. I know that it's something that we have been discussing also with the European Commission and some of the, the assessment of the cross-border directive. And it could be a potential area, obviously, but I think language barriers and all kinds of other administrative barriers are still very relevant. I don't think it plays a large role today. As for the last question that was posted, I don't know, maybe Janet, you want to take it and then we move directly over to your final thoughts, because the keynote speaker always gets to have the final word.
Wow, this final question is an enormous question. I'm not sure I can quite do it justice in the couple of minutes that we have left. What I would like to do to try to wrap up is touch on a thread that we saw in the poll question, something that came up, which I think is an important point for telemental health, and then also thinking about the pending increased demand as we think about reforms going forward. And that is the biggest challenge that came up in the poll was the workforce shortage. And as Ewout said, that actually was the impetus for this project that began pre-COVID. This was something that we wanted to look into to see. And we're learning that the mental health workforce shortage really is a challenge that many systems are contending with. And Coralie spoke a bit about the potential of telemental health and some of the advantages. And it may very well offer the advantage of helping to address stigma for those who have concerns about going to an office. But telemental health is only going to be able to close the implementation chasm to the extent that you have a workforce that is available to connect with and serve the people who need the services. So as long as you have a workforce shortage, telemental health can only do so much to reduce that implementation chasm. And then in terms of the one of the top challenges that we saw, the concerns about the pending increased demand for services. Again, our ability to address this is going to come back to, do we have a sufficient workforce to be able to serve those who need care both now and in the future? So with that, I'll be glad to hand it back over to you, Ewout.
Well, thank you very much, Janet. I really appreciate all of your presentations and the important points that were brought up. I think we have work to do. I think we will stay on the subject also as observatory. And I hope to see you in 2 weeks, I think. Next week there is no webinar. Please also enlist for our updates on our website. I think also Annalisa provided a tiny URL, sorry, so you can use that one. Then nothing else to say then. Goodbye and stay safe and healthy, and see you next time. Bye.